Yeah, Carrie, the governor's goal is to make monoclonal antibodies more accessible to everyone in the Commonwealth.
Nearly 19 months into the pandemic and Kentucky's COVID hospitalizations and the number of ICU patients is beginning to level off. Still, 2/3 of Kentucky's hospitals are in critical staffing shortages, and thousands of new cases are being reported daily.
So while this is generally good news, let's remember it still means a lot of people are dying. We had 82 deaths reported yesterday. 82.
It's why Governor Andy Beshear is continuing to push vaccines. He's also relying on federal partners arriving this week from the U.S. Department for Health and Human Services to help with monoclonal antibody treatments. And online on the state's website, Kentuckians will soon be able to access the 50-plus locations where treatments are available.
The goal is to have the network as successful and as large as we can so that people can have access to the antibody treatments when and where they need to, and hopefully in a manner that is relatively convenient.
Kentucky Health Commissioner Dr. Stephen Stack says the state received 3% of the doses allocated nationwide, which is still 800 fewer doses compared to last week. There is a nationwide shortage right now, and according to the team at Norton, the treatment is so effective at reducing COVID hospitalizations. Of the 6,000 doses given, just about 10% of patients had to be admitted. It's why they are thrilled to see the state focusing on this treatment.
I think it's an opportunity for people to that are at high risk to have a better chance to have a better outcome, and I think we're all hoping for that.
Dr. Stack, meanwhile, is hoping Kentucky's COVID levels continue the downward trend.
All of those are pointing in the right direction, and so it's reasonable to see that the demand for these antibody treatments is also going down. So knock on wood, folks, hopefully October is much, much better than September.
And so far, it's worth pointing out, availability hasn't really been an issue here locally because the antibody treatments are only given to qualifying patients, those who are, say, immunocompromised, dealing with cancer, or something similar. But the governor said today, because of the nationwide shortage, you should not count on this to save your life. Instead, he says, plan to get vaccinated. I'm Lauren Adams, WLKY News.